Good evening. You're watching Viewpoint with me, Anusha Soni. The alarming situation, the COVID situation being reported from China, has put India and the world on a high alert. The Union Health Minister, Mansukh Mandavia, has sounded an alert. He also made a statement on the floor of the House in Parliament and held a crucial meeting earlier. Today is an important day because a meeting is being chaired by none other than Prime Minister Narendra Modi to review the COVID preparedness across the country. Not just here in India, but countries like United States of America is also very worried. It has also raised an alarm over the possibility of new mutations. Now, with the reports of hospitals being overwhelmed and crematoriums unfortunately being burdened, all of those are coming to light from China. The authorities are following here in India a proactive strategy. Various other state governments have also conducted meetings to ensure that the medical infrastructure is ready to handle any kind of situation that may emerge. We keep an eye on that crucial meeting being chaired by the Prime Minister. But the lessons learned from the pandemic in the more than last 2 years, how can we be better prepared and what is the way forward? Our top focus this hour.
राज्यों को जीनोम सीक्वेंसिंग बढ़ाकर सभी पॉजिटिव केसों का जीनोम सीक्वेंसिंग करने की सलाह दी गई है।
नॉर्मल लाइफ लीड करिए, कोविड अप्रोप्रिएट बिहेवियर रखिए, सिम्टम आते हैं टेस्टिंग कराइए और प्रिकॉशन डोज लगाइए।
Well, here is a shout out to all our viewers. If you have concerns around COVID-19, if you have questions, if there is an apprehension in your mind, call us live 0120-434-1895. Are we immune from yet another wave? Are we better prepared? Do Indians have better shared hybrid immunity? Is that something that we can bank upon? And what is the method, what is the way that we should follow when it comes to the COVID protocols or the kind of precautions that the various state governments should take? Now, opening that question to our guests as well, who are joining us on the broadcast. Dr. Rajiv Dasgupta is joining us on the broadcast, who's a member of the National COVID Task Force. We also have Dr. Venkat D. Nagarajan, who's a cardiologist at the Kokilaben Dhirubhai Ambani Hospital. We also have Dr. Amit Gupta. He'll join us in just a bit, who's a consultant from Oxford, England. And Dr. Ankita Bedya, who's an infectious disease specialist from Manipal Hospital. She's also joining us on the broadcast. Mr. Rajiv Gupta, Dr. Dasgupta, I'm coming to you. How prepared are we? It is wonderful that the government is taking proactive measures like any other responsible government should. Earlier, we have seen what happened in the second wave and the so-called third wave during Omicron. The cases were much milder. When it comes to the Disaster Management Act, when it comes to the preparedness at the state level, what are the plausible steps that can be taken at this point in time? Keeping in mind that our positivity rate is very, very low. So it's not an alarming situation, but a situation to be proactive. Dr. Dasgupta.
Thank you. First, world over testing numbers have fallen, and therefore the current numbers that we see from any country, or from most countries at least, are to be understood with that caveat, and not too much comfort should be read into these numbers. Having said that, India, immunologically speaking, as far as the population level goes, is certainly a completely different entity than what China is. China is, relatively speaking, a lot more immune naive because of their zero COVID policy, followed later by the modified zero COVID policy, and then finally the December 7th withdrawal of the zero COVID regime. So that's what China has gone through. Exposure to natural infection, which produces extremely robust immunity, has been relatively less in China, and that's part of the challenge that they're battling with.
So, moving forward, when it comes to the vaccination coverage in this country, compared to many other nations, we have done far better. But in terms of the second dose coverage and the need to take a booster dose or the third shot, is that more than ever right now? Dr. Dasgupta.
No, booster dose is something where India has been able to cover roughly a third of the eligible population. of course, following the
All right.
the
Sir,
reduction
I'm
in
very sorry. I apologize. I'm interrupting you. We have the Delhi Chief Minister who's speaking on the COVID situation. Let's cut across.
टेस्टिंग में मिला है. टेस्टिंग तो हम कर ही रहे हैं. जो भी कोरोना के केसेस आ रहे हैं उनकी जीनोम टेस्टिंग हो रही है. ना केवल टेस्टिंग में बल्कि हम कई जगह से, स्पेसिफिकली दिल्ली के 7 अलग अलग जगह से सीवेज उठाते हैं. सीवेज से एडवांस में पता चल जाता है कि आने वाले समय कि शहर में ये वाला वायरस है कि नहीं है. तो 7 अलग अलग जगह से डेली सीवेज उठा के और उसको टेस्ट किया जाता है. उसमें भी BF.7 अभी तक नहीं मिला है. दिल्ली में अभी जो भी थोड़े बहुत केसेस आ रहे हैं वो XBB वेरिएंट के हैं. या तो XBB वेरिएंट है या उसके सब लीनिएज है. XBB ये 92% केसेस जो दिल्ली में मिल रहे हैं वो XBB वेरिएंट के हैं. सो अभी तक फिलहाल कोई भी घबराने की ज़रूरत नहीं है. दिल्ली के लोगों को मैं आश्वासन देना चाहता हूं कि फिलहाल कोई भी घबराने की ज़रूरत नहीं है. और बाई चांस, भगवान ना करे कि दोबारा कोरोना फैले, लेकिन बाई चांस अगर फैलता है तो हम अपनी तरफ से पूरी तैयारी के साथ हैं. आपकी सरकार पूरी तैयारी किए हुए है. एक तो जितने केसेस आ रहे हैं भारत सरकार के डायरेक्शन के मुताबिक हम सारे केसेस की, जितने पॉजिटिव केस आते हैं सबकी जीनोम सीक्वेंसिंग कराते हैं कि वो उसमें कौन सा वेरिएंट है. दूसरा, हमारी आज दिल्ली में लगभग 2500 केसेस की टोटल टेस्टिंग होती है डेली. हमारी कैपेसिटी 1 लाख तक पहुंच गई है. अगर ज़रूरत पड़ेगी तो हम 1 लाख टेस्ट्स डेली भी कर सकते हैं. आज
Well, that was Delhi Chief Minister. He said that the variant so far has not been found in Delhi and they are following the protocol of making sure that testing is done, genome sequencing is done. Clearly, the Delhi government on a high alert, which they should be. I want to cut across to Dr. Venkat D. Nagarajan as well, who's with us on the broadcast. Dr. Nagarajan, moving forward, how crucial and critical is it? And I want to reiterate that for our viewers as well, of following the basics of masking up, of hand hygiene, sanitization. Do you think it is time that the mandatory mask mandate, that should come back? Those, guidelines have been done away with because the cases had come down. Dr. Nagarajan.
Yes, absolutely. I think you've raised a very good point. I think we can't wait for the pandemic to come to India and hit us hard and then realize we have to wear the mask. So what COVID has taught us, the first wave and second wave has taught us, is that we are not independent from the world. What can happen in China can very soon happen in India. So especially with our bad experience from the second wave, and especially with all the efforts that are being put by the central and state governments, the people have to do their bit. I think people also have to understand it's not at all cool not to follow the guidelines. So I think Indian Medical Association has strongly reiterated today that people have to go back to the basics. Simple basics can prevent a lot of problems for us. So we should go back, and I think it's high time that they should make the mask mandatory again. People should take care to follow the social distancing, cleaning of hands, and as far as possible at this time, avoid parties. If it's possible, try and avoid international travel as well. And what is most important is that if you are symptomatic, if you've got fever, cough, you don't feel well, you are short of breath, you should just hold on, think for a second and contact your doctor rather than ignore the
Dr. Nagarajan, I know a lot of people, and I'm sure you do, everybody on the panel knows that all of us have made New Year plans, Christmas plans. This is the festive season which is coming in. This is the season of crowding and the kind of fairs, and people are traveling here and there. We are seeing peak air traffic and rail traffic right now. So clearly not the best of the time when it comes to COVID-19 situation. We have our first caller, Guru Raj from Bengaluru, is calling us. Guru Raj ji, tell us what you think, what your thoughts are. Guru Raj, if you can hear me.
Yes, I can hear you.
Please go ahead.
Yeah, my question, madam, to the experts is that, as the Chief Minister of Delhi said just now, that the major variant is XBB. And in addition, we also seem to have found BF.7 variant. My question to the experts is, are the vaccines, Covaxin and Covishield, that we have taken guard us against these two variants?
Are the vaccines working against these variants? I'll take that question. Shabnam from New Delhi is also with us on the broadcast. Shabnam, tell us what you think.
Good evening.
Good evening. Shabnam, I'm afraid there's a problem with your line. Now, you can try us calling again, but we'll have to hang up this call. Dr. Amit Gupta, why don't you come in and tell us more about this? The two variants, XBB and BF.7, the two variants which are primarily being found and are of concern right now, to what extent vaccines work against them?
Thank you. Can you hear me?
I can hear you just fine, sir.
Am I audible?
You're audible. You're audible. I hope I'm audible to you.
Hello? Yes, can you hear me?
I can hear you, sir. I hope I'm audible to you.
Yes, I am. Yes, thank you very much for having me on the program. I think you're absolutely right. There is some concern about the vaccine escape. But the situation around Europe and the US is a bit unclear at the moment. Although the same variant was detected in Europe a couple of months ago, the spread has not been as rapid as we've seen in China. So there is caution, but there is no sense of urgency or panic that we see in the UK. And I think that's the message that I would also like to relay to my Indian colleagues and my friends in India is, yes, we've got to be cautious because we've had a very bad experience in the past. But the situation in China and India are very different in the sense that although there is a little bit of escape from from vaccine neutrality, it's not complete. And of course, there is some protection afforded. The other thing is the vaccination rates in India are very different from China. There is probably a larger vaccine coverage. About 60% of the over 60s in China are suspected not to have full vaccination status. Okay. And so we are dealing with a very different situation between India and China. So although we should urge caution, I would not urge any sense of panic. Yeah,
it's always the safest option, Dr. Gupta, is always to take your vaccine shot. I mean, that's your best bet.
That is. So there is no exit strategy from this unless you get vaccine, unless you get immunity. Immunity is best acquired through a vaccine. Yeah. And that's what you should do. India is lucky that we've already got the AstraZeneca vaccine and the other ones which are available. And they've shown to have a good amount of protection.
Here's the answer from Dr. Gupta. Here's the answer from Dr. Gupta that if you haven't taken your second shot, you have to go and take your shot. There is no exit strategy when it comes to vaccines. That's your best way of defending yourself and your family. I want to bring in more callers. Shabnam from Delhi is back with us on the broadcast. Ashish from Gurugram is also calling us. Shabnam, first to you. Tell us what you think.
Yeah, I just wanted to ask you that if a person has comorbidities and has taken the third booster dose also, can we take the fourth one?
Can you take the fourth one? I'll ask that, ma'am, to our experts as well. Dr. Ankita Bedya is also with us on the broadcast. But before that, Ashish from Gurugram. Ashish, tell us what your thoughts are. Do you have a question?
Hi.
Hi.
See, I noticed that government hospitals in and around Delhi and in Gurgaon particularly are still not well prepared to vaccine kids above 12. I've been to hospital for about 3 months now for my kid who's 12 plus. I've had only one dose of Corbevax. They're not opening Corbevax's bottles. I don't know, there is lack of campaign. Okay. I think focus should be drawn also to 12 plus years kids and even lesser. And my question is, can the channel and the experts please advise the government to actually, trace and target 12 plus years kids?
That's a very important facet you're raising. Dr. Ankita Bedya, I'm coming to you. A person who's elderly, who's already has taken the third shot, has comorbid conditions as well, is there a protocol for them to have another shot? Is that safe for them?
So that depends, like what is the gap between when was the last precautionary dose taken? So if we go with the current government guideline in our country, if it is more than 9 months, we can go for a booster shot. So, and if we see what West is following, in US, they're following 6 months. So 9 months to 1 year, if the gap is there and you have already taken supposedly the precautionary dose in the month of January, yes, you become eligible for the booster dose and you can take it safely. So booster dose is actually going to help in preventing severe COVIDs, not the infection of COVID. As we see, these are variants which are actually changing in a way that it is able to escape immunity. So it will still be able to affect in the form of causing infection, and transmissibility will be there, but causing severe COVID and more hospitalization and ICU admission can be prevented by taking adequate booster doses timely.
Dasgupta, I'm coming back to you. And when it comes to vaccination for children in our country, the caller raised a very important point that if your kid is more than 12 years of age, and when it comes to giving protection to children through vaccination, to what extent work has been done in our country through the vaccination program? On that aspect, if you could advise our viewers.
Yes, the caller from Gurugram makes a very crucial point.
Yeah.
What is often not recognized is that with the fall in demand, the number of vaccination centers have also drastically declined. So currently, going by the COVID dashboard, we have just about, in fact, a shade below 6,500 centers working all across the country, which is of which 500 are in the private sector, and roughly 6,000 are in the government sector. This is for the entire country, which actually is a minuscule proportion of what the number of centers was at its peak, when the vaccination was at its peak. Now, with a combination of the demand falling, the scare falling, and the vaccination also falling, the number of centers have drastically come down. Now, if the government, for example, decides to go on a massive or a booster campaign on a war footing, then these number of centers will have to be reactivated really fast, almost overnight, so to speak. That is a lot of planning, quick-footed planning, logistics, and so on. That's going to be the challenge if, for example, the demand for booster comes up either from the community side, or the government or any state government decides to accelerate vaccination, particularly for boosters.
Kulvinder from Chandigarh is also calling us. Kulvinder ji, tell us what you think. Do you have a question? We have the experts on the broadcast. Please go ahead.
My question is very simple to the panelists. Is the situation more scary while seeing the China's situation? That's number one. Or are we really having something on the ground that's not being disclosed? So that's a precaution.
Okay. You are basically arguing, sir, that is there a fact which is not being reported, or we are merely alarmed because of the Chinese situation? As far as I know as a journalist, is because of the kind of surge that we have seen in China. That's why the Indian government is so worried. Our own numbers are not very staggering. I'll also take the experts on this. Ravi from Ballari, Karnataka is also calling us. Ravi, tell us what you think.
Hi, ma'am. I want to ask that I have two kids who is having, 6+.
Yeah.
What is the update of vaccine on that, and what is the precaution we need to take if they're below 12?
Okay, I think we do need to have a discussion around children as well. I'll go to Dr. Nagarajan. Dr. Nagarajan, the situation in India is not so alarming when it comes to the number of cases being reported. So I've heard this question a lot in my family as well, that why are we so alarmed? Is it only because of China, or perhaps there are indications, or perhaps something that we don't know and the cases are going to rise? Would you want to answer that kind of fear?
Yeah. So I'm not so sure that we are, 100% sure that the cases are not on the rise. One, we have become complacent about the COVID. We are not routinely testing. So people even who have symptoms may or may not be reporting. And also we have not, we should learn from our previous experience. We should not go by the absolute numbers. I think people should still follow the basics. And in a country like India, when the sort of pandemic hits, there is not much time to take an action. So I think prevention is better than action. So we don't need to panic, but I think people need to do their bit. They can't have a short memory and forget what has happened during the second wave. Okay. We are not geared up to treat when there is an actual pandemic, or when there is rampant COVID. I don't think we can cope with that. Although we have done as much as we can. So I think our strength lies in sort of educating people, trying to sort of prevent that situation, encouraging people to have their vaccinations, and also highlight to the people.
All I can say is that we've reported, India has reported numbers honestly. When it comes to COVID-19, we have not hid any kind of data, and we are not hiding any kind of data. So there can't be any conspiracy theory around there. I have two more callers, Rashmi and LV Srinivas. But before that, I also want to have a quick word with Dr. Amit Gupta when it comes to the vaccination of children in India. To what extent it has been successful, and what is it that we can do more? When it comes to younger children as young as 6, to what extent globally speaking, even in countries like US and continents like Europe, to what extent children have been made protected against this because they also have natural immunity. This virus has not been able to affect children as much as it affected adults.
It's very true. I think the issue around children's vaccination is a bit controversial because the number of deaths reported in children are very few.
Yeah.
We don't have pediatric intensive care filled up with children infected with COVID. However, we've seen a small but significant number of children with MIS-C, which is a syndrome which is related to COVID, but it's not directly to COVID infection. Now, so the balance of vaccination and protection versus COVID in children tilts towards a reassurance because you've got if you look at Omicron as well, it doesn't cause the degree of serious disease that it causes in adults. So I would reiterate my earlier point that yes, there is this worry about this variant.
Yeah.
This variant is already present in Europe. It was detected in the UK in the last couple of months. The spread in the UK has not been extensive. And I think we should not copy and paste the situation from China because China is a very different ballgame. So I would say, yes, we should go ahead and do the routine masking and making sure social distancing is in place.
Absolutely. I'm very short of time, sir. I'm sorry I'm interrupting you. I have a lot of callers who are waiting. Rashmi from Vadodara. Rashmi, tell us what you think.
Yes, ma'am. I just wanted to know that it has been quite some time that we had taken our booster doses, almost maybe more than 6 months. So what is the update on the 4th dose? And the other question I had, is there any facility wherein we do have nasal vaccines for all of us in our family? And me and my husband are 50 plus people. And plus my son is on the go, like he's all the time traveling because of his job. So we wanted to know these two things, nasal vaccine and the 4th dose, because we had taken our booster doses well in time.
All right. I will quickly take that question to Dr. Rajiv Dasgupta. Dr. Dasgupta, nasal vaccines and the 4th dose, if you can answer that question quickly for our viewers.
Very, very, very quickly, there is still no recommendation of a 4th dose, even those with additional morbidities and so on. But 3rd dose, we have a huge shortfall in terms of people who have turned up. And nasal vaccine is still not available at a scale that we know.
So, sir, there's no 4th dose according to the protocols followed in India.
That's right.
That's right. All right. LV Srinivas from Belagavi is also calling us. Srinivas ji, tell us what you think.
Yeah, good evening.
Good evening.
I am from the Indian Red Cross Society, and we have done a lot of work during the last pandemic. Mostly we find that there is now people are thinking that the COVID has gone and they are not taking precautions. Second thing is regarding the 3rd booster dose, there is lack of awareness in the villages particularly. And fortunately, we have the biggest manpower or woman power called Asha workers who have to be empowered and educated to tell the villagers that, yes, please take it so that you can be safe.
I'd like to know your question, sir.
One last thing I would like to tell is that people should be made aware that tobacco and liquor, these two things bring down the immunity.
Absolutely. So a healthy diet and a healthy lifestyle, of course, is the basic of that. Jayant Mishra from Bhubaneswar is also calling us. Jayant ji, tell us what you think.
Yeah, I have one question, actually 2 parts of the same question. Do we have data about incidence of infection with people who have taken the booster dose and people who haven't taken the booster dose? Is there a difference?
Okay.
And the second part of the question is, since the variant is so different every time, how does the same booster dose, I had taken COVID vaccine 3 doses, how will it work with the new variant?
How will it work with the new variant? There is no definitive answer to that, sir. We had another caller asking this question. And the best, bet all of us have is a vaccine right now. But vaccines, yes, there is a certain degree of escape mechanism like Dr. Amit Gupta was, talking about. But the booster dose efficacy, that point I'm going to discuss with our guests. I want to take 2 more questions. Uttam from Belagavi is also with us. Uttam, tell us what you think.
Yes, madam.
Uttam ji, bataiye, what is the question you have?
Madam, I have taken the first dose. Okay.
Hello.
I can hear you, sir. Please go ahead.
Yeah, I'm hearing you. I have taken the first dose.
Yes.
But the second dose I have not taken.
Okay.
Okay, because of here, at least you have to be 60 years.
Okay.
Then only you will get the second dose. They have applied the rules.
Okay, that's strange because I don't know.
55 years old.
Okay,
Yeah.
I'm afraid, sir, there's no rule that exists like that. But I'll get our experts to clarify on that one. Pradeep Singh from Delhi is also joining us. Pradeep ji, what do you think?
Yes, a question for Dr. Nagarajan. There's been a lot of speculation, but also some data that the vaccination is leading to clotting, which is affecting cardiac conditions of a lot of people.
Okay.
My question specific is that if this is true, and if somebody is on antiplatelet medication and also blood thinners, possible that in the eventuality that a vaccination does lead to the side effect of clots.
I'll discuss that side effect with our guest as well. I want to cut across back to Dr. Rajiv Dasgupta, Dr. Ankit Baidia, who are with us on the broadcast. Dr. Baidia, I'm coming to you. The side effects of the vaccines, and more importantly, if there are people who are already taking medications, say blood thinners or any kind of antiplatelets, what is the precaution you would advise to them when it comes to vaccination?
So actually, I have come across a lot of people who think that the people these days, young people who are coming with cardiac problems or young strokes is because of the vaccine complication. I must say that COVID itself, as a virus, COVID itself has a tendency to cause blood clotting, and many people who doesn't have symptom when they have active COVID and doesn't know that actually they had COVID. So this could be a side effect of a COVID infection rather than vaccination.
Okay.
Vaccine per se is not a wholesome COVID virus that is being given to you, which is in the live form.
Okay.
So as such, it is not going to have that complication, one thing. The second thing is this vaccination is going to protect you from severe disease, not from the infection per se. So it is majorly to prevent severe disease.
Severity of the disease.
And apart from this, no hesitancy there should be just related to side effect of the vaccination.
Okay.
It related to antiplatelets and blood thinner. It is majorly the IM site that has to be checked, because there are risk of bleeding per se, but not as a side effect of vaccine is increased. It is just as an intramuscular injection as the vaccine is being administered.
I want to take two more points before I close the show. Booster dose and its efficacy. Dr. Dasgupta, coming back to you. Booster dose and its efficacy. And we also had a caller from Belagavi, I think, who said that for taking the second dose, you have to be 60 plus. I don't think there's a protocol like that, sir. Is there?
Oh, no, not at all. If you have taken the first dose, please take the second dose. And then after the appropriate interval, take the booster. And I'm sorry, what was your first question?
So the first question is about the efficacy of the booster dose. Suppose you've taken one shot or two shots. With the third shot, how much of your immunity is really boosted or it goes up?
See, for most people, for the vast majority in India, what we are having is a combination of both exposure to natural infection, plus you may not have had clinical COVID, but many actually had subclinical forms. Plus vaccination. That's the situation for the majority, or what we call hybrid immunity, and therefore the immunological status of the population is a lot more protective than what we are seeing in China. And the experience through all the previous Omicron subvariants that we have gone through in India is that we have seen that there haven't been severe cases, there haven't been very many hospitalizations, and certainly very minimal deaths.
I thank you all for joining us on the broadcast, Dr. Dasgupta, Dr. Nagarajan, Dr. Amit Gupta, and Dr. Ankita Baidia. Thank you all. We once again reiterate that we are back to the basics of following your hand hygiene, wear a mask if you go to crowded places, avoid crowds as much as you can, and your governments are also doing their job. We'll continue this discussion and much more here on CNN News 18. It's a wrap from my side. Ridhima joins you with more details on the biggest exclusive.